Thank you for having me. My name is Abigail Holmes, and I am indeed one of the consultant midwives for Cardiff and Vale. Thank you. And I'm also a qualified personal trainer, and I run the Cardiff and Vale services for active pregnancies, and I also do some training outside of the health board. So, yeah, that's me with some of my clients. And just to give you a little bit of history about myself, well, many of you that know me will know that the gym is one of my happy places, which is strange, I know, but it is. But you need to understand where my journey started and how I did really come to love fitness and everything health related. Well, it started 9 years ago. You can see one of the photos where I'm very lucky to have two very beautiful daughters. And my first birth was a forceps birth. My body created this wonderful baby that I gave birth to, but the forceps took a toll on my body. I would have usually described myself as someone with a weak bladder before I started my journey with fitness, but I now know I had an untrained pelvic floor and core. Continence really did become an issue for me, and honestly, for 5 years, I did absolutely nothing about it. I had a second daughter, a beautiful water birth. My symptoms didn't change, but they got no worse, they got no better. So I simply carried on, and I avoided the activities that would trigger some concern, and I would break into a little bit of a cold sweat when the children asked to go to a trampoline park. 3 years later, I decided I needed to do something to improve my fitness. So I went to an abs blast class, as you do at the local gym. Couldn't do any of it. It was awful. I hadn't cared for my postnatal body. I hadn't enabled myself to recover. And with that, I had a dysfunctional pelvic floor and a diastasis rectus. I obviously looked rather overwhelmed leaving this class, and a PT came to talk to me. I had 2 PT sessions, thought I could do it, jumped on a treadmill. 5 minutes in, my bladder emptied. As you can imagine, I was devastated, and I knew that I needed to do something about it. 3 years forward, I'm pleased to say I have a totally restored pelvic floor, I have good core strength, and I'm also now a qualified personal trainer. And I support women from preconception to postmenopausal to be good in health and be as active as they possibly can be. So I hope during this session I can inspire you, not only for your own health, but for the women that are in your care. So you can see a list here, and these are very given what women want to avoid. They want a healthy, straightforward pregnancy, and this means a pregnancy that isn't complicated by gestational diabetes, preeclampsia. They want to control their weight gain in pregnancy. They don't want to become incontinent. They don't want long labours, and they want to avoid an instrumental birth. And then when we move into our postpartum phase, again, they want to maintain their continence. They certainly aren't wanting a prolapse. They want to maintain good mental health. They want to control that weight gain and not allow that to continue, which in that postnatal period, when you're slightly sleep deprived, making your food choices aren't necessarily the healthy options, but they are indeed the easy options. We've also got those wonderful pregnancy hormones still floating around. Relaxin at times can cause women to feel a loss of strength, and with that becomes inactivity. As women become inactive, they lose their stamina, and it starts to set into this cycle of low energy, low mood. So we need to think about what is happening to the female body when we're in labour and when we give birth. I'm not going to go through the entire anatomy of the pelvic floor, but we have good evidence that tells us the levator muscle, the pudendal nerve that provides the innervation to the anal and urethral sphincter can have some damage, as can the endofascia that surrounds the vagina and divides the pelvic floor into its anterior and posterior compartments. And we know that for some of our ladies, they will also suffer from anal sphincter damage on occasion if they suffer from a 3rd or 4th degree tear. Now, for most of these women, this will recover on its own, but not for all of our ladies. And if we look to our current obstetric population, we are seeing an increase of the age of a prima gravida. We have good evidence that tells us increased maternal age is a risk factor for having pelvic floor trauma. We also have an obesity crisis. An increasing number of women have type 2 diabetes. This puts increased pressure on the core and the pelvic floor. We're seeing our bigger babies. So it's really not surprising that we're seeing more and more trauma. And in the last 10 years, The number of women presenting for prolapse surgeries has increased by 55%, and the number of women requiring surgery for urinary incontinence surgeries has increased by 30%, and we are where we are with issues of the mesh in gynecological services and things like that. There's good evidence to suggest that our older pregnant population are at higher risk, but still it is really important to know that over 30% of women presenting with urinary incontinence symptoms were between 30 and 39. I think that's pretty shocking data. The Chief Medical Officer's report, a little old, in 2014, went on to say that 33% of women suffered from urinary incontinence and 10% of women were experiencing fecal incontinence at 6 weeks postpartum. 10 years later, 20% of these women are still reporting incontinence and 3% are reporting bowel incontinence. Now, whilst this is morbidity and not mortality, the number of women that this is affecting is enormous. And these are just the ones telling us about it. This is the tip of the iceberg. Many women suffer in silence and carry on with weak pelvic floors. We can tell more about the Birth Trauma Association. They give us very good data that tells us that these women are suffering from chronic pain, bladder and bowel problems, sexual and relationship problems, sometimes leading to the breakdown of relationship, low sexual self-esteem, negative genital body images leading to postnatal depression and PTSD, which we've just heard about in our last pregnancy, and tocophobia for subsequent births. So to give you an idea, well, how common is a prolonged injury? Anything between 6 to 10% from our vaginal birth, spontaneous vaginal births, starting to go up with our ventouse, and up to 71% of women experiencing a forceps birth will experience some sort of pelvic floor trauma. So the reality is that this is very common. This data is from an MRI study in 2013, and I just picked one study to talk about, but there's hundreds of them out there. Now, of course, I haven't put on the slide that the only way to avoid this is to have a caesarean section, which gives you a 0% chance. But I'm not suggesting that that is our option at all to avoid pelvic floor trauma. But it really is something that's very common. And then we're faced with adverts on mainstream television. Hopefully this will play.
What is it that millions of women find hard to talk about?
I wet myself.
See a little trickle. Whoosh!
A little bit of leakage.
The main thing is laughing.
Sneezing,
Lifting.
Dancing.
I'm a comedian. Peeing myself is kind of an occupational hazard.
Leaks happen. That's why Always Discreet has a super absorbent core that turns pee to gel to help stop wetness and odour.
I love being a mum. If I have a little leak, who cares?
It's perfectly normal.
Always Discreet. Let's talk about leaky bladders.
It's perfectly normal. Have we lost our minds to suggest to women that leaking bladders is normal? Can you imagine? Sorry, well, I whip off my pad before I go to bed with my husband because I've got a urine-stoked pad on. But we're okay because Tenor have bought out scented ones to cover the smell. There are two most common reasons why women in older age are requiring residential care, and that's for loss of continence and loss of mind, and this isn't acceptable. You might be wondering why I started telling you I was a personal trainer and I spent all this time talking about pelvic floor trauma, but I do have some logic to what I'm trying to tell you. To understand my passion for this, I wanted to start at the end and explain to you the end results that these women are living with and show you what my contribution hopefully can help reduce for these women. So, we need to be future-proofing our bodies, and it's great. It's official. Exercise is not only safe, but it's recommended in pregnancy. And this is the ACOG guideline, which is American, so I'm not going to read the definition of exercise. But it's telling you, if you're pregnant and you're a CrossFitter and you deadlift 100 kilos, carry on doing it. Maybe drop your weight slightly and possibly look to speak to a pregnancy-trained personal trainer, because it's really important that pregnant women have a safe environment to exercise in and someone that respects the physiological changes that occur to a woman during her pregnancy. During the first trimester, there's decreased vascular resistance that starts, but Whilst that's starting, the blood volume isn't doubling quickly enough. So you have your venous return is reduced and you see your women feeling dizzy and faint. You certainly don't want that in the middle of a gym or an exercise class. Centres of gravity are changing. There are postural changes. The abdominal muscles are becoming weaker and longer. The anterior pelvis begins to tilt anteriorly. There's an increased lordosis of the back for women. The glutes become weaker, so that's going to affect the way the women are running and the way that they're walking. Towards the later stages of pregnancies, and we've probably all seen it, and if you've had a baby yourself, you can remember this happening. You start to walk with your feet turned out, and that's to aid your centre of gravity, and most pregnant women do it, and we probably say they're waddling a little bit. But by turning the feet out, you start to have hip and pelvic pain. We know women are suffering from pelvic girdle pain, so if we can introduce some sort of activities to help them realign their postures, we can reduce the incidence of pelvic girdle pain for these ladies. You have to understand that it's an intrinsic synergy that the body has going on. You can't look at all of these things in isolation. As the feet turn out and we get lower back pain, the upper traps in your back become tight, there's restricted movements of the lats, the breathing becomes impaired. Everything is linked and you have to respect that. Pregnancy exercise classes need regression. As your pregnancy continues, the exercises regress. Now that's unusual. In a gym, you try to work harder and harder every time you go. And as the pregnant ladies are training, it gets easier and easier and easier. You move away from weights, you move to resistance bands. But actually, it's becoming harder because of the changes that are going on in their body. The tension's altered in the trimesters that affect pregnant women. It's not just the abdominal wall that changes, the pelvic floor, the lumbar and thoracic back change in the whole global system. As the transfer of load is managed differently, as the woman is constantly changing, it's essential that exercise is prescribed in a safe fashion and that we respect the changes that are going on in the woman's body. In the first trimester, I would have a lady happily on a rowing machine, then there's a pretty large bump in the way that's going to make that quite tricky by trimester 3. But it's having that knowledge to understand. Really pleased, last week, perfect timing. The UK Chief Medical Officer published the updated version of what is considered safe activity in pregnancy. 150 minutes a week, it's nothing. 3 30-minute sessions, easy to be done, and activities that you probably women are doing in their daily lives anyway. And it would be really nice to see charts like this in the All Wales antenatal records. We've got smoking, we've got alcohol, we've got the eat well place, but the good news is I'm the author of the All Wales notes, so it's really easy to get that one in there. They've also, for the first time, given us postnatal guidance, which they didn't do before, so that's great. And teaching our women that actually we want them to be up and about and active. This is from birth to 12 months for what our ladies should be doing, and it's actually really exciting. So if we think about the pelvic floor, again, when do we teach them? Because it's way too late to teach them when they're postnatal. Ideally, I think it should be part of the school PE curriculum. Girls, boys, all need to understand what their pelvic floor does and what the core does, because men need their pelvic floors just as much as we do as women. It aids urinary and bowel incontinence as they become older, and it improves sexual function. Tell a 16-year-old boy that, I'm sure he'll sit through a PE class on your core. How many of us ask women, do you do pelvic floor exercises? And they nod. And they probably leave the room going, I'm not really sure what my pelvic floor is, and I certainly don't know how to engage it. And you need strategies to teach women how to engage their pelvic floor because it changes during pregnancy. The motor control signals are altered, and unless you have a way to teach them in a new style, they're not going to feel the benefits of doing those type of exercises. I imagine most units give women a postnatal leaflet that says, off you go, please go and do your pelvic floor exercises. We know, written literature, women don't read it, and in the postnatal haze, probably it's not something you're thinking about doing. It should be taught, ideally at schools, if not preconceptionally, But if we've missed that bit too, let's try and teach them in their pregnancy. And then think of new ways of teaching things. So you're on a postnatal ward, instead of sitting going through 1,000 leaflets with them that either goes in the recycling, or unless they've got a specific problem, they go to find the leaflet on that. Give them 90-second YouTube videos. We know what captures people's attention. Don't give them a 10-minute training video. You'll lose them after 2 minutes. But quick, short, sharp bites of how they can learn to do their pelvic floor. And it's also really important to think about when the pelvic floor fails you, because mine certainly wasn't failing me when I was sitting still. That's when I could pretty much guarantee it was pretty good. But as soon as I went to move, that's when you have your problem. When you jump, when you sneeze, you cough, you laugh. It's these unexpected, sudden movements that causes the concern. So let's train women to activate their pelvic floors whilst they're moving. That actually is quite hard to do. It takes training, but on a structured program, you can get it. I have taught women who really had very little bladder control on exercise to be totally continent when they're training. And it's all about the way that we breathe. And it kind of relates a little bit to hypnobirthing. We teach women to hold their breath and use a Valsalva movement quite often in the second stage of labour. That puts an incredible amount of strain onto the abdominal wall muscles and the pelvic floor. But actually, we use that method more than we realise that we do. We do it quite a lot when we're lifting heavy loads, which I'll talk to you about in a second. I try to make my slides are in a different order. I try to make my exercise classes fun, because sitting on a Swiss ball for an hour is really dull. You try to create programs that are functional. What does a new mother need? How do you embrace all of those components that a woman is wanting to do? You'll have some educators would suggest, well, women shouldn't twist or turn when she's exercising in pregnancy. I challenge anyone that's pregnant with a toddler not to twist or turn when they're doing something with their child. This doesn't really make sense. So, these are all in different order. Okay, so movement of motherhood, and this is my programs, and this is what I want to teach women. We want our women to be strong now. Men do all of these things, but this presentation is about women. So just to put that out there, I looked at the list and I thought, oh, that's sort of a bit sexist there, but women are putting prams into cars, and that's when you do the Valsalva maneuver, because if you've lifted a pram, they're really heavy, and they don't fit very well in boots of cars. So you hold your breath, and you grab it out, and you do that Valsalva movement. The abdominal wall bows, the pelvic floor bows out, and you're causing more trauma to yourself. So it's about how does a mother breathe when she's lifting the shopping, when she's carrying a car seat round. Now, I would suggest a car seat with a baby in it is at least 6K. If I asked you to walk around this room carrying a 6K dumbbell, you'd soon get tired. Our women need to be strong, and we need to prepare them for that. Now, I liken those moves when I'm training with women to squats, lunges, vertical movements, twisting. We have names for some of the moves that we use. We use things like a clean and press. Now, I'm not suggesting that a woman moves that into her daily life and moves her child to the side, squats down, picks up a weight, presses it above her head with the shopping or any of those kind of things. But you can make it really functional and how it's going to help her in her daily life, but also how it's going to help her for her labour and birth. And there were just a few examples that I've got. We've got good quality evidence that tells us that women that exercise during pregnancy, women that train their cores, women that are higher stamina levels and are stronger have shorter labours. They have shortened second stages of labours. It reduces their chance of having instrumental births, and therefore it reduces the chance of significant perineal trauma or pelvic floor trauma. So if you think right back to the beginning of the presentation, 71% of women having a forceps birth will encounter some form of pelvic floor trauma. If we can get women active and healthy during their pregnancies, we can reduce those numbers. And that's just my small contribution towards it. I'm not suggesting by having a woman come to an exercise class one hour a week, we're going to eradicate forceps births, but we absolutely can make a positive impact onto that. Can't deny that this is becoming a global epidemic. Women facing pregnancy coming into pregnancy obese. We need to prepare women for motherhood. We need to support them to be as healthy as they can. We need to be them active and have a good nutritional diet during their pregnancies. The impact of obesity on the body is profound. Some women are starting their pregnancy with extremely elevated BMIs. They don't lose the weight they gain in that pregnancy and go on to have a subsequent pregnancy with an even higher BMI. We need to invest in educating these women to be the healthiest version of themselves. But it is also important to be very clear that there are very clear guidance on women that absolutely should not exercise in their pregnancies. Significant cardio disease, lung disease, if you've got a cervical cerclage or there's threatened preterm labour, a low-lying placenta, severe anemia. These are just a couple of the things that if I was seeing a lady, I would suggest that she didn't take part in an exercise course. I have a good screening tool, and if you ever meet a PT and doesn't ask for you to fill in a medical questionnaire, walk away. And then moving into motherhood. You'll never be the same again. I'm not sure I like that phrase, but you do hear it said quite a lot. And I do think there is an element of truth of it, and I think we should be high-fiving women. They're not going to be the same again. They're truly amazing. They absolutely rock. They grew and gave birth to a tiny human, and now they're looking after it. But that transition to motherhood is fraught with anxiety. We know that exercise can help with body image. It can improve their mental health, increase their self-esteem, build relationships, social interactions with the other mothers. One of my postnatal classes has 6 mums in it. They're really good friends now. They maybe not the best thing, but they go out for coffee, I'm sure cake as well after the session. But they've met some really good relationships. Sleep patterns are improved, they're stronger, their energy levels are increasing, which enables them to engage more with their families. So it's all got to be a bit positive for me. So just to recap, core strength training and core rehab. Core strength is absolutely essential to labour and birth and motherhood. We need to teach women to make the connection with the whole body and not just look at isolated elements or movements and make it functional for their daily life. There's a really good evidence that Kegel exercises work, but that's your foundation. Kegels, stood up, standing still, we could all do them all day long. Put a squat, a lunge, a jump, and try to activate your pelvic floor at the time, and that's when women start to run into trouble. But we can train the body to do that. Remember that the body is altered during pregnancy and we need to allow for the movement and balance. Ladies in the first trimester will probably lunge quite easily. You need something for them to hold on to in the 3rd trimester because they're going to fall over, their centre of balance is off. Excuse me. And just before I finish, and my final thought is that we're all women and we all come in different shapes and sizes, and labour and pregnancy does affect us all in very different ways, and women should be supported and celebrated to be the best version of themselves. Continence is absolutely not a luxury item. It's essential, and to suggest incontinence is normal is insane. We can work hard to prevent it, but for those we can't prevent it for, we can certainly give them the best chance of curing it or recovering from it. So there are a huge amount of benefits to exercise in pregnancy, and I suggest all health boards should seek to provide some sort of antenatal provision for women to be active and even consider postnatal. So, well, I've been here today. One of my lovely ladies has had her baby. So I'm going to give you some quotes from the ladies I've had. So, a postnatal lady, I don't pee when I sneeze anymore. That's a real great success for me. One of the pregnant ladies said, my arms have never looked so good, and that's from some of the weights that we lift. And one person told me she doesn't get stuck on the floor anymore. She was pregnant, down on the floor with her toddler, but through doing squatting and different type of movements, she springs back up because she's gained that strength in her lower body. And today, the lady that gave birth this morning was asked if she'd been hypnobirthing during her pregnancy and the labour. We didn't practice hypnobirthing, although I'm a practitioner. I don't do hypnobirthing in my antenatal classes, but we do breathing. We finish every session with some visualization and breathing, and she's used that through the birth of her baby. So I'm delighted to say she's had a very nice birth in one of our local units. Not one of Cardiff's, but one of our local units. So yes, sorry, that's me. I think I've rattled through that a bit. I do apologise for talking a bit quick, but if you have any questions for me, please ask. doesn't look like there is any, so that's all right. Come on then, Julia. What's your question, Julia?
Thank you, Abby. That was lovely. So, but thinking about if you're talking about an antenatal programme, what does that look like? How long? How much?
Okay, so my programme is 6 sessions. That's 6 one-hour sessions, and everyone in the room will do the same workout, but on different levels of difficulty. So if there's someone in the group that has done previous training or is currently active in her gym or out and about, she may have a slightly heavier weight, whereas someone else will be doing it only with their body weight. Someone in the first trimester and the third trimester, while they'll have the same workout, they'll have different aids to support them. So if there's a set of lunges that I'll be asking them to do, first trimester, as long as she's not feeling dizzy or faint, she can do that, no problem. The third trimester is most likely to have a bar or a bench or a chair to hold on to, just to make sure she's got her balance. And some will use weights, and some will use resistance bands, and some will use body weights. But it's a structured program over the 6 weeks. It always finishes, the way you do an exercise program, you should always finish on the core strength. So we finish on abdominal workouts, which is very different on a pregnant lady, because you don't want to actually overemphasize the abdominal doming, but they'll finish off with the core breathing and those kind of things. So yes, it's a set program. And the ladies at the moment, if they finish the 6-week course and they want to continue, one of them has started again and just wanted to go through the program again, and then others are looking at different ways that we can do things. That's where we are at the moment for the ones that want to continue after 6 weeks. I don't want to put them right back to the beginning. So that's where we are at the moment.